Good evening, everyone. Welcome to the Future webinar series. I'm Ahmed, and I'm an education team member in the BEHA Futures Foundation. Tonight, we will host very special guest, Professor Dr. Pamela Habibovic, Rector Magnificus of Maastricht University and the founding partner of MERLN Institute for the Technology-Inspired Regenerative Medicine. I will now let the professor to explain more about her work and her career, which is very special, and I think her road to becoming rector will be inspiration for many of our students. Also, I want to thank you so much for being here with us tonight, and we are so honored to have you here, and thank you for supporting Bosnian youth.
Thank you, Ahmed. Thank you very much. Can you still see my screen, just to make sure?
Yes, we can see everything.
Good. Okay. Well, thank you for inviting me. It is a pleasure to be here. Indeed, my name is Pamela Habibovic, and I work at Maastricht University. And in preparation of this webinar, I was actually asked to give a kind of a mixed story about my own career, but also a little bit about my research, or the research of my research group. And that's why I chose for the title Regenerating Damaged Body Parts, a Matter of Right Tools. And I understand that many of you are engineers joining today, and I hope that I will be able to convince you that also in biomedical applications, such as regenerative medicine, that I will talk about a bit more in the detail later on, you will see that engineering is very, very important. But let me start with a few words about myself and my career. I was born in Srebrenica in 1977, and this is the good times when the city was as I knew it when I was a child. I left the city or the town actually in 1992 at the very beginning of the war, and I never returned. Unfortunately, I am still planning to. I was actually planning to go back earlier this year, and it didn't work out. But I'm hoping now my own children are a little bit older. I am hoping that I will have the chance to visit again. So I came to the Netherlands in 1992. And I finalized my secondary education here. So actually, I finished the 3 years of my secondary education before deciding actually what to do. And when I was a child and when I was doing my secondary school, I had the idea of becoming either an anthropologist or a journalist. But when I came here in 1992, the knowledge of Dutch language was not great. And I basically decided to focus more on math and chemistry and physics, because I simply needed less of a language for that. So it was easier to learn formulas than to learn history that I needed a lot of knowledge of language for. So that is why I, in the end, also decided to start studying at the Hague University of Applied Sciences. So this is basically in the Netherlands. It's a kind of, you have 2 types of university, one that brings you to up to a master's degree, and you have universities of applied sciences that offer a bachelor's degree. And I started that in 1999 with the idea, or actually 1995, I should say, with the idea to only do 1 year to give myself a little bit more time to learn the language, and then to step over to the university and study journalism or anthropology. But then I have to say, after 1 year, I felt very comfortable at where I was. I also very much enjoyed chemical engineering, and I did not feel like starting over again. So I already had quite a start coming from abroad, learning a language, and then starting again. So I kind of said, well, I will just stay here and finish this. And I indeed finalized the study of chemical engineering in 1999. And during my studies, actually, in the final year, I was offered a possibility to do an internship in the Philippines, which was for me a very exotic place, but very attractive. And I went there, and that was actually the very first time that I was in contact with scientific research. I was working in environmental science, and that was the first time that I thought, well, doing really a research or being a part of doing a scientific research is something that really appeals to me. So when I came back, because in the Netherlands, it's not common that with only a bachelor's degree, you do a PhD, which you normally do if you want to be a scientist. So I just started working as an engineer in a biomedical company. But very soon, actually, I was asked if I would be interested in doing a PhD anyhow. And that was possible because I had a professor who basically said, okay, although you don't have a bachelor's degree, I think that you may be capable of doing that. So he was a kind of, giving a guarantee that I could do a PhD. So that is how I started my PhD. I was working on materials science, in particular materials for biomedical applications, and I got my PhD in 2005 from one of the 4 universities of technology in the Netherlands, University of Twente. And then after that, I pursued my scientific career in a kind of conventional career. I went for 2 postdocs, one at Children's Hospital in Boston, one at McGill University in Canada. And then I returned to the Netherlands to start my own research group, first as an assistant professor, then as an associate professor. And in 2014, I became a full professor. I moved also to Maastricht University, where I was actually together with a team of people. We were asked if we wanted to start a new research institute at this university. And that is also, that was very interesting because we could really start from scratch and build something new, build a group, build new laboratories, and really set up a new research line at a different institute. I became a scientific director. So next to being a professor, I became a scientific director of MERLN Institute. That is how the institute is called. And earlier this year, I was actually approached and asked to become the rector of the university. And I will actually, at the end of my talk, after a more scientific part, I will come back to what that really means at the moment. So as I mentioned, I would like also to show you a little bit about the scientific research that I've been doing. And before I go into details of the field of regenerative medicine, and that is the field that I'm active in, I would like to introduce the concept of regeneration. And regeneration is something that we know from this type of animals, like newts. And what you see here, this is a paper from Nature Communication. And what you see here is in a newt, when a limb of a newt is amputated, so removed. This is a study, obviously. Basically, you don't have to do anything, and just with time, the entire limb will regrow again. And this is really without any intervention. So it is really just about 140, 150 days are needed to regrow the limb. And the limb, as it regrows, it actually does not only look the same as the original limb, but it has also the same functionality. And it is very interesting if we study, because a lot is known about this process. And if you look into what happens there where the injury was, so where the limb was amputated, then you see that there is a very, in time, but also in space, there is a very interesting process going on where the right signals are being given to the body, inside the body, and the signals that are actually ensuring that the limb will regrow again. Now, this is the inspiration for many people working in regenerative medicine, because we would actually like to accomplish the same in patients, so in humans. But that is, as you will probably know, it is not something that is very common. So if we lose a leg, we can wait for a very long time, but nothing really will happen. So we don't have this ability to regrow entire body parts. But that does not mean that humans do not have a regenerative capacity. I think a very nice example is just a cut. If you are cooking, if you cut yourself, the skin, it will start bleeding. If it's a small cut, the cut will stop bleeding very soon. A small scar will be formed. But normally after 2 weeks, you will probably not be able to even see where the cut was. And this means that also humans have the ability to completely regenerate the skin. Now, I was predominantly active in the field of bone regeneration. And also there you will know if, especially if a child falls and breaks an arm, all you need is really to put an arm in a cast. And also there, the bone will completely regrow again. So it will regenerate, and after a few months, you will not even be able to see where the defect was. However, the regenerative potential of a human body is much more limited than that of newts. And here you see some X-ray images of a much more complicated situations. On the left-hand side, you can see a spinal fusion, and spinal fusion is actually in your spine. You have the vertebrae, and between the vertebrae, there is a piece of disc, so it's a soft tissue. And if this degenerates, so if it is defected, then patients have a lot of pain. And what surgeons normally do is to fuse the two pieces of vertebrae, so the two bony pieces. And there you actually need to form new bone. Other example is trauma. Think of a car accident where large pieces of bone are damaged. And in that case, really just putting a leg into a cast is not enough. So you really have to intervene. Another example is a bone tumor. Very often, if a person has a tumor, the tumor will be removed from a bone, but then you are left with a very large defect, a very large hole in a bone. And if you don't interfere, so if you don't do anything, the hole will remain forever. So it's actually, the body really has a limited regenerative potential. It cannot just without intervention heal itself when the defect is too complex or too large. So what is the treatment, the best treatment nowadays? It is actually the state of the art in this type of field is that you take pieces of bone elsewhere in the body, very often in your hip area, and you will transplant it to the defect area. Now, this works quite well. However, very often complications occur. Many patients experience pain, even 10 years, often 10 years after pieces of bone being removed from the hip. You need two surgeries. So on one hand, to remove pieces of bone, on the other hand, to transplant it. But the most important limit is limited availability. You can only remove about 20 cc of bone without long-term side effects. And this is actually becoming very problematic because we are getting older, especially in the Western world. And because of that, the chance of people being injured or having bones injured is really increasing. And at a certain point, there is simply not enough bone to be removed in order to treat the defect. And I explained the story actually about regenerative medicine to a famous cartoon maker here in the Netherlands. And he said, well, and he actually very quickly draw this cartoon. And he said, well, it's a great job that you're having. You're actually creating one problem by solving the other. And that is exactly what we don't want. So we are actually thinking about alternatives. How can we make something that we can use to regenerate large bone defects without having to harvest pieces of bone from the patient or from a different patient? Like that could also be an alternative. And that is actually what I have been working on for a long time. So how do you normally do that? In principle, if you are trying to develop something that is, for example, synthetic, that you can produce in large amounts, but can be used instead of a natural bone, then you normally think about what you try to understand first, what kind of a material is a bone. So you really look into the composition of a natural tissue and try to think about how can I mimic, how can I make something that looks like bone, and how can I make it in large amounts. And bone is actually a very intriguing organ. It's not even a tissue. It's really an organ that is innervated, that is vascularized. But even if you think about bone as a material, it is actually very intriguing because it is a composite material, so it consists for a part of a polymer, a collagen, and a part of a mineral. And these two are very, very intertwined and built in a very hierarchical way. And that is also what gives bone such a excellent mechanical properties. That is also why our skeleton can actually carry the entire weight of our bone. So very often, if you think about how do you approach a problem like developing an alternative for a natural bone, you often take an inspiration from nature. So you try to study the natural tissue and then you try to develop it. Now, what did we do? So this is just some details about it. As I said, the bone consists for about 70% is a mineral, so it's a ceramic material, hard material, and then about 30% of organic phase, and there is of course some water in it. And if you look into it, it has many different cell types, many different proteins as well, but simply looking from a material science perspective, from a chemical perspective, you have a mineral phase and an organic phase. And this is what we can actually, especially the mineral phase, and we call it hydroxyapatite, it's a calcium phosphate. That is something that we can actually produce quite easily in the lab in very large amounts. And how do we do that? Here I have an image of a Dutch Delft blue cup, but it is actually a ceramic material just like a cup. And I want you just to realize that this is just to explain to you the procedure. How do we do it? It is actually it's like making a ceramic cup. You have a powder, you mix it with some kind of a binder, and then you bake it at a high temperature to make a cup. And that is also how you can produce ceramics for biomedical applications. Of course, the powder that we use is slightly different, and the temperatures are slightly different that we're using, but the process is pretty much the same. So here you see a few examples of the type of calcium phosphate. So again, this is the mineral that is found in natural bone that we can produce in different ways. So you see on the left top are small particles that are porous and that you can use as a filler. So for example, imagine that your defect is in the jaw. You can use this small type of particles and you can fill the jaw there where bone needs to be created. You can use 3D printing to create also custom-made materials. And we can even make pastes. And this is sometimes important for clinicians because they would like to be able to fill the defect because defects are not perfect. And with a paste, you can easily fill the defects that are not perfectly circular shaped, for example. So what we have done, and this is now goes a little bit more into details of the research that I've done even during my PhD. But what we've discovered when we were making these calcium phosphates, you produce the powder of a calcium phosphate. The composition is very similar to that found in a natural bone. This is important because this ensures that although this material is completely synthetic, it will be accepted by the body because it will be recognized as something that is natural to the body because the chemical composition is exactly the same, at least of the mineral part. Now, as I said, we produce the powder, we make it porous because we also want the bone, when you implant the material, to grow inside, right? So you make holes in it. And what we were playing with is the temperature at which you bake it, or we call it actually sintering, so at which you sinter the powder. Because during baking, like even for the ceramic cup, what happens during baking is that individual particles of the powder will fuse into one another because of a high temperature, and they will create a solid structure. And that is exactly what we were doing here. Now, what we discovered among others in this study is that depending on whether you choose a slightly lower temperature of 1150 degrees or you choose a slightly higher temperature of 1300 degrees, you get a very different structure. And that is logical because the higher the temperature is, the more the particles will be fused into one another. So if you keep a temperature somewhat lower, you will see that the structure will be more rough and it will be more porous than if you use a higher temperature. Now, why is this important? We implanted these two types of materials, which from a chemical perspective are exactly the same, so they are identical. So the only difference between the two is the baking at higher or lower temperature, and hence the structure that they have that is different. And what we discovered is that actually the material baked at a lower temperature is able to trigger the body to form new bone. So we've done that, and this may sound a bit strange, but the only way by which you can investigate whether something is able to trigger the body to make new bone is to implant it somewhere where bone normally does not grow. So what we did here, this is a study done in animals, in goats. We implanted these two materials in a muscle, and in a muscle normally the bone does not grow. So what we discovered there is when we implanted the material sintered at a lower temperature, we observed that actually what you see in this upper image in red, what we observed is that actually in a contact with the between the implanted material and the muscle, there was a very thin layer of newly formed bone. So this means that this material was actually able, without any addition of cells or anything, completely synthetic material was implanted, but this material was able to trigger the body, to give the body the signal, you have to create bone here. And so the signal, whether it is a chemical or structural signal, was enough to trigger the cells, the stem cells that are present in the bodies, to become bone cells and create new bone. And this is very much like the signals that I explained in the beginning about the newts, that also there the signals were given that the limb had to grow. So that is how you can compare it. Interestingly, with a material that was identical from a chemical perspective, but baked at a higher temperature, this was not the case. So there was something about the structure in combination with the chemistry. And although this was interesting to see that if you implant it in a muscle, it creates bone, a little bit of bone, the best test was to implant actually these two materials in a very large bone defect where bone does not grow naturally, and that would not heal naturally, what I mean. And again, also there we observed, and these are the images of a bone healing on the right-hand side. You can see what you see in pink is actually newly formed bone. And what we observed there is that actually only the material one was able to completely fuse, bridge the defect, so really allow bone to grow inside and completely close the defect, whereas the second material did not have the property. So we really discovered that there is something about the structure of these materials that is able to trigger the body to create new bone. We continued working on this. We continued really tweaking the chemistry and tweaking the structural properties. And this is really a process of about 10 years with the entire team of people working on this. A kind of a trial and error a little bit, because sometimes it's also very difficult to change one property without affecting the others. But we were really working systematically. And eventually, we were able to develop materials that were more and more able to trigger the body to create new bone. And you can see that here again, we have 3 different materials, and you see more and more pink. And you will have to believe me, because if you're not used to looking to this kind of histological sections, but you have to believe me that this, again, implanted in a muscle, what you see in pink is really a newly formed bone. So we were able, by tweaking the properties of these materials, to really have a material that were more and more able to trigger the body to regenerate a large bone defect. And this was actually something that we also, again, tested in a large bone defect. This is a defect that was created in this triangular hip bone, and again, large defect that does not heal spontaneously. You can see that also if you don't implant anything, it will remain like that, so there will be no healing of the defect. And what we showed is with the best material that we could develop, so again, synthetic material, that is what we call here TCP, the lowest one, we actually were as successful in healing such a large bone defect as if you would implant a patient's, in this case, animal's own bone. So we were actually now able to develop a synthetic, inexpensive alternative for a patient's own bone for healing a large bone defect. And based on this, at a certain point, a company was started, and I don't have a conflict of interest here because I was not involved in the company itself. I was involved in the research before that, but the spin-off company was created, and they actually brought two products on the market that are being used worldwide, for example, for use in spinal fusion. But really based on this development, how do we make something that is really capable of triggering the body to heal such a large bone defect? So really something that we looked into, something that is inexpensive, that you can produce in large quantities, and for which you are not dependent on the availability of the own bone of a patient or a donor. Now, this really sounds like a great success, obviously, because you do research, you do a lot of experiments in a lab, you do some animal experiments which are required in order to bring this really into the patient. And finally, you are capable of developing something that is really used in real patients. And this really sounds is a success story. On the other hand, for me as a scientist, there were many questions that remained unanswered. For example, even at the end of this entire process, we could not really give you a perfect recipe. This is how a perfect material that is regenerative for bone should be made in which way. But also what you should know, just like the coffee cup that we were talking about, this type of materials are actually very brittle. So like if you drop the cup on a hard floor, it will break. Also, these materials, you can even, if you squeeze them between your fingers, they would break. And this is a kind of counterintuitive if you think that you are using it for bone that should be carrying your entire body. So indeed, what we are now working on is really try to think about how can we improve the mechanical properties, how can we make these materials stronger without losing this ability to trigger the body to start regeneration. And this is also, so now again, going into complexity of a bone. And if you remember, I told you bone is not only this mineral, and it's not only ceramic, but it's also a polymer. And now we are thinking about how can we improve these mechanical properties without losing the bioactivity and without making them too complicated, because you want them to be very simple and inexpensive. And of course, you are never satisfied, because with these materials, the healing process takes 12 weeks. You would like to have it in 3 weeks because you want a patient to walk as soon as possible. Again, there is a lot of the ideas, how can we enhance this bioactivity? How can we make the materials even better than that? So this is something that my research group and many others in the world, by the way, are still working on. So we've learned a lot, but there are, again, like in research always, there are many questions that remain unanswered, and we are always thinking about further improvements. Now, before I told you a lot about bone, but this is also because this is something that I worked on for about 20-25 years. But just to give you an example, that there are also other body parts where similar developments are being done. This is by colleagues of mine at the Eindhoven University of Technology, and they, instead of bone, they are actually working on heart valves. And heart valves is also something, especially for children that are born with congenital malformations where the heart valves do not completely close. They cannot, so the heart valves of a child, they cannot completely close, and that is why the heart is not pumping the blood properly. And for these small children, especially for the babies, you cannot easily use artificial heart valves that are often made of metal, because they are big, and you can imagine a baby will grow, and every time you would have to do the surgery over and over again. So what they have done, very much analogous to what I explained just before about materials for bone, they have looked into what is the material that heart valve is built of. And in this case, it is not a ceramic, but it is a polymer. And they have really tried to develop a similar polymer and make it in a mesh that also resembles the heart valve, and made heart valves out of this. And these heart valves, they are actually just like the ceramic, and I did not say that before, but just like the ceramic that I showed you, they are actually degradable. So they will just trigger the body for a while to make their own heart valve, or a bone in my case, but in the end they will disappear. So again, inspired by what is found in a natural tissue, you develop something that is synthetic, you give it a certain properties, and you develop it in such a way that it triggers the body to repair itself, after which the material that you've implanted will disappear. So here again, this is a lot about polymer chemistry, but it is really about how do you tune the properties, how do you tune the degradability, so that you have the material long enough in the body to complete this process, or to trigger the body to regenerate, but then disappear in time as well, not to hamper the further on. So there is a lot of chemistry here, there is a lot of synthesis, but also a lot of fabrication. How do you make a mesh that really looks like a heart valve? Do you use 3D printing like methods? Do you use methods like electrospinning? So there is a lot of engineering on the engineering side as well that is trying to bring those two together. And then again, there are other examples, because now I was talking about a heart valve that is one type of tissue, a bone that is one type of tissue. But if you think about, for example, a joint, then you have and bone and you have cartilage, and they are two completely different types of tissues that are both degraded in case of osteoarthritis, for example. So here the situation becomes a bit more complicated. You need two types of materials, because you cannot work with one. The question is, how do you combine them in such a way that they are able to fulfill the role like it is in the normal joints? So again, additive manufacturing or 3D printing is used for this a lot, and there are a lot of engineering developments there to think about, on the one hand, materials science, on the other hand, engineering, but that all in the context of the body, because it is not, you are really limited to the materials that are accepted by the body, because if you use something that the body will reject immediately, then you will obviously not achieve your goal. Now, the last thing that I wanted to mention in this context of using engineering in biomedical applications, in this case in regenerative medicine, is really something that you also have to realize, that the developments do not go as fast as they do in many other pure engineering applications. I took here an example of an old-fashioned typing machine versus an inside of a computer nowadays. But you could also think about a development in aviation or space industry. These developments really go extremely fast. If you would compare any type of implant, because this is, I believe it's from the type machine is sometime from the 60s, and the computer from now, if you would compare the implants that we had back then in the 60s and now, the difference is really much, much smaller than you would see in many high-tech industry. And the reason for this is not because we are not as good engineers, but the reason is actually the acceptance as well. We are often talking about in this field, I often say, with the materials that we are using now, you really hit the limits of the innovation that you can fulfill. But you could much easier, for example, trigger the regeneration if you would think about implantable mini robots, where you can, with the feedback loop, where you can measure in the body what is needed when. You could have micro pumps that could, pump in something that the body needs at that very moment. But we should not forget the ethics behind this kind of developments, and also the acceptance by the people, by the patients. People will rather, have something that really looks like bone than a mini robot that you can on demand, remotely control. So regardless of the fact that you may be much more efficient if you would use more high-tech solutions, in this type of applications, you really have to think about what is, what are the ethical implications, but also what do people want to have? What do I accept inside my own body? So there is really a fine balance between how far you can push the innovation and what you can actually apply in a clinic. Now, to finalize, because I also really want to have questions from you and answer these, because I think that is the most important one. What I really like about this type of research is that it's very, very multidisciplinary. When I was working in the institute before, I literally had a colleague who was a nano engineer. I had somebody who was a physicist. I was working with a clinician, and I was working with a biologist. And we really need to have all these disciplines together, because the problem that you are trying to solve is really, really complex. And I hope I have given you a little bit of a feeling for the problem of having a body, having a material science, having chemistry, having an engineering, that all has to come together. And this is also what I really enjoy the most about this type of applications or this type of research, is that you are really forced to even learn to speak each other's language, which is not always very trivial, right? So I mean, if you are trained as a biologist, you are trained as an engineer, you grow up in different worlds. And for this type of applications, and luckily for many others, you really have to find the way to talk with each other, to understand each other, and to together develop this kind of solutions. And that is difficult, but it is also very, very exciting, because it really opens up your horizon as well. Now, as I mentioned in the beginning, I have about a half a year ago, I have kind of changed my job from being a professor, being a research group leader, to becoming a rector. And here you see an image from our recent opening of the academic year, just at the beginning of this month. And this is a very, very different job. I have very limited time to really be involved in the research. I still am, because I still have a number of PhD students and postdocs whom I'm supervising, but really with a limited amount of time. And luckily, I have ensured that they have other supervisors who are there for them. But maybe just to tell you why I made this choice, maybe relatively early in my career. And the reason is that although I really like research and I like doing research and being a scientist, there is also a certain culture in the academic world that I think is still very much individualistic. And although we really have to work together, the way we reward our scientists is very much focused on an individual. And I would really like to change this. I would like us to work more in teams, and to also where there is space for everybody, and not only the big professor who is publishing all the papers, but because the big professor, without all those people in the team, is nothing. I mean, if I would dare, I'm to be honest, last 10 years, I've only seen the lab when I was having, a guest to show them around. But if all those PhD candidates, all those students, master students, postdocs walking around, they are responsible for a real research. And this is often not visible. in the academia, and this is really something that I would like to change. And there are a few other things that I would like to change in the academic world, which I'm hoping to contribute by being a rector. And this is not only the research, but of course also the education of all students, because we also have 22,000 students at our university, very different disciplines. And also for them, we are trying to create an environment that is inclusive and as welcoming as possible to give you the opportunity to really develop yourself. And another reason why I chose to do this is because I also wanted to continue learning. And I really have a very new job, a job where I really had a feeling that I was doing things for the very first time I had no idea about. And this is also important, I think, also in your further career, is that you challenge yourself to also learn completely new things that are out of your comfort zone. Because that also is challenging, and that's also how I experience it now. I'm enjoying it very much, and when I get time to again focus on my research, this is really like a bit like coming home. Like that is something that I recognize and that feels very comfortable. Now, with that, again, I would like to close, but not before thanking all those students in my group that I have had the privilege to work with in the past year, as many collaborators that I've had. And again, this is everything that I've shown you is actually their work and not necessarily mine. I was just trying to supervise them and be a good mentor. And of course, last but not least, I also have to acknowledge the financial support by the many organizations, because scientific research is really very often dependent by external funding. It is not something that is easily embedded within the university. So it is very important that we have funding in the Netherlands, in this case, in Europe as well, that supports this type of research. And with that, I would like to close and thank you very much for your attention. And I'm very pleased to take any questions that you may have.
First of all, I want to say thank you for holding this extraordinary presentation. While now our participants can feel free to write either in the chat or Q&A section any questions they have for the professor. And while we're waiting, there's only a couple of questions right now. I would like to ask you, how did you find it difficult to find the materials that body wouldn't reject? Or was it something that you get along with trial and error, or did you have some other ways to see what the exact materials would not how to say it disrupt the body cycle?
Yeah, it's a very good question. And actually, as I mentioned, very often you kind of try to mimic what is already in the body. So you try to find to basically try to make something that is already in the body, like and we know that. So a lot is known about what materials we find in our body. It is not easy to synthesize everything, and then we also indeed search for synthetic alternatives. And normally, yes, you have to go. It's not really a trial and error. It's more of an educated guess that you think about. Okay, well, this is what the body should be able to accept. I develop it, but then you still really have to go through the process of testing it. That's very important. And luckily, you don't only you put it in patients and you see if they die. We don't do that, but there is a lot of work done beforehand, a lot of in vitro work with cells that you start testing even before you test in the animals, because the animal, I'm really looking into alternatives of animal studies, and we only use the animals when you are quite sure that what you know is something that you also really want to use in patients. But before that, there is a whole trajectory and many different types of tests that are being done to ensure the safety before you actually go into the patient. But yeah, it's a kind of an educated guess based on a knowledge of what we know from the body and a lot of really research and testing.
Thank you so much for clarifying. So the first question from our participants is, Do you see a solution to the ethical principles of applying nanotechnology and metals of inorganic origin in the next 5 years? And can nanotechnology help in the process of faster and better regeneration on the nano level?
Yeah, now excellent question. And I think, yes, nanotechnology has a huge potential. And I think there is really a lot that is already being used. The beauty of nanomaterials is that you actually can really control their properties to a nano level, obviously. So they are often used as a kind of also as a multifunctional materials for therapy, but also for diagnostics. Cancer treatment is one of the very well-known examples. But indeed, we are also looking in regeneration. How can we functionalize nanomaterials in such a way that they even better trigger the process of regeneration? So there is a huge potential. Now, when it comes to ethics, I think it's not even the ethics is a problem. I think it's more the matter of safety. I think there's still some concerns about nanomaterials and a kind of the ability of us to control them in the body. But I think there is more and more evidence coming in, and I'm sure that you also see that with all the approvals as well by FDA, for example, or EMA in Europe, is that you see that there is really a progress going on there. So yeah, huge potential and really, really interesting materials. It's also something that in our group we are using, especially the mesoporous silica, so it's an inorganic ones, a huge potential for sure.
Thank you. And our next participant says that their professor, thank you for the interesting presentation and topic. How much time is needed for a person to undergo this procedure? Is there any way to improve or accelerate the process by specific supplements, chemical elements like calcium or some other activities? And you also mentioned that this kind of regeneration is successful for a longer bone damage. What percentage are we talking about?
Yeah, it's a good, all very good question. So I think the procedure, so it depends really on the size of a defect. The problem is that although the ceramics that I've shown, as I said, they are brittle. The problem is a little bit because they are brittle, you cannot really start walking immediately. So you either have to fix it, or you have to still use some kind of instrumentation, so the pins and plates. But that's actually not the idea behind regeneration, because with regeneration, you don't want permanent implants that you have to remove. You want to implant something, trigger the regeneration in the body, and then it disappears. So this is this type of improvement that I was talking about. So the timing, it really depends. I mean, the experiments in animals that I've shown you, defect healing of about 1.5 centimeter takes about 12 weeks, which is quite long for a patient if they can't walk. So you would indeed like to accelerate that, and accelerate it by, yes, there are a lot of ways to do that. It could be by supplements, it could be by physical therapy. So there is indeed the entire process, clinical process that should accompany this type of treatment. And I think that the final question was, I forgot the last part of it.
I also, yeah, it went away from me too, but we can continue to the next answer to the question. I think it kind of relates. The same participant wrote it. Can we expect the use of nanotechnology and inorganic material in the treatment and prevention of osteoporosis in the balance of osteoblasts and osteoclasts in the future based on the chemotaxis mechanism and the targeting drug delivery?
Yeah, I definitely think so. I think it's really something that I see the potential of, and it's what I see a lot of future in is a combination of this kind of materials that I showed today, that are kind of structural materials, but then combined with nanomaterials that are able to really deliver a certain compound, whether it is a growth factor or something else. So there is a lot of potential there. And even if you really think about targeting, I think in this case, it's in the future, yes, it could possibly be that you really just inject, so that it's kind of minimally invasive. We are not there yet, and I think with this kind of large defect, you still really have to open the defect unless you work with smaller defects and they're injectable. But eventually, I can imagine indeed that you could think about minimally invasive application of nanomaterials that could kind of target or be taken to the defect area. So there is a lot of research going on there as well.
Thank you. Our next question is, what is the body response like to the regenerative examples you mentioned? Have there been cases where the body didn't react well to those materials? I would also like to thank you for the amazing opportunity to learn more about regenerative medicine.
Yeah, you're welcome. So what is the body response? So in principle, you always have a kind of initial inflammatory response. So you have a kind of that is with whatever you really implant. The question then is, of course, how biocompatible. So how well a material is accepted by the body. So the ceramics, as I showed it, they are really capable of, because they are very, very, very similar, chemically very similar to what is found in bone, they are really able to create a direct bond with bone. If you have materials like many polymers, where where biocompatibility is not so high, what you sometimes see is a kind of fibrous tissue. So actually the body creates kind of soft tissue around an implant, and that is a way of a protection. So the question is really about the properties of the material. The ceramics, as I use them, we really don't see any issues at all. I mean, initial inflammatory response, which is a combination of implantation and just placing something, but that is cleared very quickly, and what you then see is just really a direct bonding to the natural tissue. With many polymers, this is more of an issue.
Okay, thank you. And our last question in Q&A would be, given that the participants' knowledge in the biogeneration is very limited, what are your hopes for future discoveries in the field? What would be the highest Boston discovery of bioregenerative medicine? And as someone with a slight tinnitus, something to aid that would be incredible.
Yeah, so I think what is the kind of the promise of regenerative medicine is that we will go from kind of care to cure, and I think that the examples that I showed you today are successful, but they are easy. I think that when it becomes really complicated is if we think about organ regeneration. So if we really think about complex organs like heart, like kidney, and then you're really thinking about healing chronic diseases. If you think about people who have a chronic kidney failure and they need dialysis, for example, or you have people with diabetes, this is if we would find a way to regenerate really organs, complete organs. I think that would be that would be amazing if we would succeed in getting there in 10 years from now. There is a lot of work going on, but that is much more complex, as you can imagine, than a bone. Well, a bone, as I said, it's complex, but it's one type of tissue. You can kind of control it. If you think about the kidney, it has really many different functions, and thinking about how to doing that. Also there, I'm not sure if we will ever be able to do it only with synthetics. There, we may have to use cells, or we may to use organoids. So we really need to really, from the beginning, involve biology, which again is making it more complex. But yeah, we are trying also to solve a more complex problem. But in principle, the kind of a dream of people working in this field is to get rid of chronic diseases by regenerating the patient's own organs and functions that they fulfill.
Thank you so much, Professor. And my last question from me would be, I would like to go back to the heart when you talked about different phases. Would there, like at this moment, at this stage, would it be possible to do some things with electrical shocks to keep heart going or from failure, or is that not possible to do with all the organs? And would there be possible problems in trying to for body to not reject those impulses, or to not turn it the way worse than it is right now?
Yeah, no, so I think it's something that is certainly being done, and not indeed in the heart, but also in so electrostimulation is really something that is being considered as a possible therapy. Also developing materials that would react to it. So conductive polymers, for example, and so on. So there is certainly work going on there. It's so it's whether you do it as an external stimulation or you do it through materials that you've implanted. But there is certainly some research in that direction. I'm not an expert there, but I know that there is research going on in both developing materials that are conductive that could be used, but also direct therapy using electric stimulation.
Thank you, Professor. We also got two new questions. So the first one would be, is it possible at this moment, or will it be, and how soon, to regenerate bigger parts of body and bigger bones that have been damaged? For example, bones damaged by tumors, and avoiding rotatoplasty or other invasive surgical procedures.
Yeah. So indeed, I mean, with tumors, that is certainly something that we are working on, and tumors, especially if they are big and there are large pieces missing. So again, I mean, this type of materials that I showed, they have their limitations, but there are other possibilities as well. So I think bigger parts of bone, that is rather feasible. I think even so what we cannot do, and it's an interesting research being done, and that as well, as people have been trying to look into amputations, if you could really indeed regrow amputated part of a leg or arm, and we are not there yet for sure. So that is really something that is more complicated. But large pieces of bone, in principle, that should be, I mean, that is rather feasible. And what you also see very often if we talk about bone tumors is that you also see development of materials, especially with nanomaterials, that they have a kind of a dual effect. So on the one hand, they would treat the tumor, so they have an anti-tumor properties, whereas at the same time, they would also help regenerating the defect that was created there. So indeed, there are a lot of developments in that direction too.
Thank you. And for now, our last question is, are all patients eligible to get this type of surgery? And what are specifics that could make patient not ready for such recovery? Is it about health or something else?
Yeah, it's a very, very good question. And I think it is, in principle, there is no reason not to use it in different patients, unlike some other growth factors. So if you think, because normally also other alternative for bone regeneration is to use a certain growth factor that is also available on the market. But there, this growth factor really can cause a lot of, well, I mean, there are some concerns about, for example, tumor formation. So patients with a history of tumors are not allowed to use this type of growth factor. For the ceramics, it's the ceramic that I explained, there are no restrictions. However, what is important is that, of course, not every patient has the same regenerative potential. The older the people are, well, basically with aging, the regeneration potential of people decreases. And also if people have other systemic diseases, also there you can see that regenerative potential is negatively affected. So from the safety perspective, there is no reason to choose one or the other. But whether the treatment will be successful will not only depend on the material, but it will also depend very much on the patient, him or herself. And this is something that is, again, one of the challenges in this field. Now we have a kind of one material fits all, but what you would like is to indeed get information about the patient and be able to kind of develop a personalized material that fits that patient the best. And so really having a kind of personalized treatment. But again, we are not there yet, and that would also make the treatments more expensive, but certainly something that for the future would be very important to try to develop.
Thank you so much. And also one last question from me would be about nerves. And is there possible ways to regenerate nerves? On the way, is there some way to stimulate or to make some new ways to, when we, let's say, make a bone in the arm and the ceramics, would there be, let's say that the arm was cut off some nerve, is there a possibility to regenerate nerves also?
Yeah, nerve regeneration is really a huge field as well, a very complex one, a really difficult one, and also depending on the type of nerves, whether it's central nervous system or peripheral nervous system. But yes, there is a lot of going on there, very, very intriguing field as well. So yes, there are ways to kind of make conducts, so to basically to reconnect the damaged nerve again. So there is a lot going on there as well. So indeed, normally the innervation would, if you have a healthy tissue, at a certain point you would get a natural innervation. You would hope that a natural innervation would occur, but indeed there is a lot of research going on specifically on nerve regeneration. It is not easy. It is complex, but also for that a lot of material science is going on to really make indeed conductive materials that would be suitable for reconnecting damaged nerves.
Thank you so much for clarifying. And we got another question also. When we talk about possibility of regeneration and age, would this kind of regeneration help with inverted bone anomalies?
Oh yeah. So what we've so you really think about anomalies like that people have a very like diseases where bones break easily or a lot of bone that is being formed. I suppose that is what is being asked. It's difficult to if we cannot communicate. I think so. Yeah. So yes, there are a lot of diseases where you have a kind of not normal bone formation, and we learn a lot from these as well. Now, this type of treatment that I showed today is really for local treatment. It's not something that is systemic, that could cure a bone disease, for example. Yeah, I mean, imagine a simple one, osteoporosis. There, we cannot treat osteoporosis as a systemic disease with materials, but you could develop materials that could treat defects that are caused in patients with osteoporosis. So, but we do learn a lot from diseases where you see bone anomalies, because sometimes you have diseases where you have a lot of too much of a bone formation, and from that you can also try to get an inspiration and to learn how the body does that. And of course, in those patients you don't want it, but in the defects you do want a lot of bone formation to be formed. So indeed, there is a number of diseases that are often genetic diseases. So it's really they are not local, but it's more systemic diseases. But we can learn a lot about, and we do already, in developing this kind of regenerative therapies.
Thank you so much, Professor. I think that's all for the questions. I would, if it's okay with you, I just want to say another time that we are honored to have you here, and I want to say thank you for hosting this extraordinary webinar, and that some participants maybe would now go to biomedical bioengineering after hearing your webinar, and I really hope that in the future we will have opportunity to listen to you or one day meet you in person. I just want to say thank you so much.
No, thank you. It was a pleasure being here today, and I'm also very pleased to see so many of you out there. And good luck with the foundation. Good luck also with the studies of students. And I really hope that that some of you will consider going into this area, which is really, really exciting. So thank you very much, and good luck with everything.